So whether you've recently fallen on the ice or you're expecting a baby, many people from all walks of life turn to a chiropractor for help.
Dr. Sam from Ascend Wellness specializes in pregnancy and pediatric care, and Sarah talks with her about how chiropractic care can help you.
Good morning. I am here at Ascend Wellness in Minot with Dr. Sam. Thanks so much for having me.
Absolutely. I'm so glad you're here.
Oh my gosh. Okay, so I'm not gonna lie, chiropractic care kind of wigged me out a little bit.
Yep, it does for some people. Yep.
But tell me, why is it so important?
So truly with chiropractic care, what you're really trying to do is bring the body back to factory settings. Just stressors in our lives, be those what most people think of, like physical stressors when you're going to a chiropractor. So like slipping and falling on the ice, we might have some issues with that currently. Or getting in a car accident or a sports injury, things like that, that's gonna put a lot of strain on the body, and then the body stops really working at like full capacity. But there are other things, there are the chemical stressors as well. So that's anything you put in or on your body. So think preservatives in our food. Think things that we're inhaling, like kind of toxic candles, things like that. Or even like what we're washing our clothes with, what we're washing our dishes with. There's just so much chemical. And if our body doesn't respond well to that, then our body stops functioning optimally, and it's hard on our nervous systems, which is what chiropractors deal with. And then emotional stress. I mean, we just came out of the holidays, so there's a lot of family stress. But so that stress can also be really strenuous on your nervous system. And so chiropractors are in the business of helping free that system and getting your brain and your body to communicate properly.
So your specialty really is prenatal and babies.
That is actually my specialty, pregnancy and pediatrics. With pregnancy, I always think a lot of people are like, why would a pregnant mom need to be adjusted?
Yeah, because her hips and her,
Right, exactly. So I always like to, whenever I have a mom in the office and they know, like normally they're coming to me because they have low back pain, or they have round ligament pain, or pubic bone pain, or they can't sleep. They don't have enough energy to chase around maybe their other littles around the house. And so I kind of just start by explaining to them what their bodies kind of look like and how everything works. So I always try to have them picture a hot air balloon, okay? So you have that balloon that always wants to stay upright. And then you have, if you think about what it's connected to, that basket, and you have the 4 ropes. So I don't know if you can picture that now.
Totally, yeah. I can see it in my head.
Perfect. So that is, if you want to kind of think about it like that. Now let's think if we were to shorten one of those ropes. What's going to happen to that balloon? It's going to tilt. And then when we're out of balance and we're tilted, we're probably not going to be super comfortable. So that's very similar with the mom's uterus. So that uterus is the balloon, and then you have your ropes in the front, your round ligaments, and then you have 2 ligaments that are attached to your pelvis, your bony pelvis, in the back. So when we get a restriction from those stressors I talked about, or if we have tightening in our round ligaments, which are mainly muscle, if you'd like to believe it, then that can throw you off balance. When you get out of balance, and you're gonna get pain in your round ligaments, you're gonna get pain in your lower back, you're gonna get all of those things.
Well, it's like all connected, right? Like if you hurt up here, it just trails down.
Exactly. So my specialty is actually bringing balance to those things. So removing the restrictions from the nervous system, working on the round ligaments. It's actually called the Webster technique. So that is the specific technique that I use on my pregnant moms.
That's really cool. So with babies and infants and children, like what should a parent expect when they bring their kid in to see you?
A lot of the times I think we were talking earlier, you can get really nervous when you're like, I don't know what chiropractic looks like in babies. I promise you there is no popping, clicking, twisting, turn, like none of that. So really like the pressure that I use to assess and then therefore adjust an infant is actually when you go to the grocery store and you pick up a tomato and you're checking it for ripeness, that pressure you put, that's as much pressure as I use to adjust an infant. And what I'm looking for is just restrictions where, again, the nervous system has interference. We want to remove that so that brain and body works better. Some reasons parents will bring their babies in to see me would be a traumatic birth experience, like whether that be a really long labor, a labor that turned into a cesarean, vacuum or forceps extraction. Those things would be considered traumatic. Or they're having issues with latching. Baby's not latching to one or both breasts. We're having issues with colic or just excessive like fussy and gassiness. Or baby's just not happy, constantly crying when they're fed and they have a clean diaper, and then parents are just at their wits' end. There's probably a reason they're crying. They might just be uncomfortable and they're trying to talk to us about that. And so kind of that is a lot of the times what I deal with. Those parents just kind of just frustrated and they want to help their baby, and I want to be the one that can help them as well. And truly, it's so amazing to see it. Normally after 1 or 2 adjustments, that system is clear. And then even getting into like out of infants, we're getting into toddlers and a little bit of older children. We see a lot of kiddos for ear infections and bedwetting as well.
If you have any questions, make sure you reach out to Dr. Sam at Ascend Wellness. Back to you in studio.
And to reach Dr. Sam at Ascend Wellness, give them a call, 701-852-5070. You can also go to the website right there on your screen.